I will start introducing the afternoon session. Now that we have started the morning with the administrative level and a lot of research input, this afternoon we'll now be focusing on different stakeholders' approaches. How do the different groups, actors, take the responsibility? What is going on already? It has been mentioned several times. There is a lot going on. And in many cases, it seems more like the communication between the different stakeholders is one part of the solution. And that's why I'm very happy to start with one topic that has been mentioned several times, which is procurement. Pauline Göthberg is the National Coordinator for Social Responsibility in Public Procurement, and in that function also covers pharmaceuticals. Welcome.
Thank you very much for the invitation to come here and speak about the role of public procurement. I work, as Nikolai said, as a national coordinator for the county council's work, and our main responsibility is healthcare. I find the title for this session rather provoking. The goal for the Swedish healthcare is really to give all people living in Sweden good health and equal access to good health care. But are we at the same time causing environmental, and I would like to add social problems as well? Well, the answer is really partly yes. And therefore we also have to assume responsibility for our part of the value chain or the life cycle. Professor Larsson highlighted many of the problems associated with pharmaceuticals, and many of the other speakers as well before lunch. And we know that the problems are many. They are extensive. I, together with some of the chief procurement officers, went to Hyderabad, India in 2013. And Hyderabad is one of the pharmaceutical hubs in India. And these pictures are taken from the backyards of the pharmaceutical companies. And much indicates that emissions from the pharmaceutical companies are still occurring, like 11 years after the first reports came out. And we know that both the groundwater and the soil around this area is polluted or contaminated. And regulatory bodies are struggling to fulfill their duties. Public procurement is more and more being used as a political tool to reach different societal goals. And I know that there is much work being done to include environmental concerns in the good manufacturing practice, but that process is slow. So using public procurement is a way to act now. The county councils have, since 2010, been cooperating and developing a national framework for sustainable procurement. And we procure goods and services to the amount of 120 billion Swedish kroner. So we're trying to use our joint buying power to create a demand for responsible and sustainable products and services. But many of the products that we buy are being manufactured in developing countries, where we know that the risks for human rights violation, labor rights violation, and environmental risks are high. And through our code of conduct for suppliers, we are trying to ensure that the products we buy are being manufactured in a responsible way. We cannot conduct healthcare in Sweden to the detriment of people somewhere else in the world. In Sweden, we procured pharmaceuticals to the amount of 35.9 billion kroner a year. As this picture shows, the pharmacies are by large the biggest buyers. But they have, on the other hand, little possibility to make these environmental and social demands due on their prescribed pharmaceuticals due to the reimbursement system. However, I know that there are a lot of initiatives, or some initiatives at least, to make this demand on O2C products. The Swedish county councils, on the other hand, we buy for 7.5 billion kroner. So it's not really our joint buying power that is driving the change. But I do sincerely believe that Sweden as a nation has a role owing to its political ambitions, to its sustainability policies, but also I think the influence the sustainability procurement practices has on other countries. What we see in Sweden is now happening in many other countries, not least in Norway at the moment, after the television program that showed these kind of problems as well. Our methods for sustainable procurement can be described like this. We have a code of conduct for suppliers that has been politically adopted in all the 21 county councils. This is based on the UN Global Compact 10 principles. We also use the National Agency for Public Procurement, their criteria for environmental. And these are being implemented as contractual clauses. So what does that actually mean? Well, we want our suppliers to have implemented procedures to ensure that the active pharmaceutical ingredients, but also chemical, will cause as little environmental harm or effect as possible. When it comes to the social criteria, we want our suppliers to have procedures that at least contain a due diligence process according to the UN Guiding Principles for Human Rights and Business. These are the criteria. And additionally, we also want our suppliers to make it possible for us to do our own inspections or by third-party inspections. And I would also like to mention that these criteria is throughout the supply chain. So we haven't decided this is just for the first tier, second tier, so throughout the supply chain. But making the demands are really easy compared to doing follow-ups. We have developed follow-up questionnaires for the social criteria, and we have also developed, in cooperation with the Göthberg University, follow-up questions for the environmental criteria, and where we want to ask questions regarding the supplier have to define where and what stage there are potential discharge, identify what is actually analyzed and found, and also identify what kind of technique, what kind of cleaning techniques they are using. So at the moment, 3 county councils have done follow-ups on the environmental criteria, 3 county councils have done follow-ups on both social and environmental criteria. And we have also done 2 on-site audits at Pfizer. I'd like to mention also that these kind of audit reports are also made, we share them among all the county councils, but they will also be made publicly available because we think this is an important issue. We are dealing with public money, so this is, we should be transparent regarding this. I would just say that this method that we have developed has proven successful in other risk areas. Last year, the Corp Watch organization of Swedwatch went back, I should say, to Pakistan, where a lot of our surgical instruments are being produced, and checked how the factories have developed during the 8 years. And they have showed significant improvements to working conditions. Last year, we also went down to check how our surgical gloves were being manufactured in Malaysia, and we found severe violation in regards to trafficking, depth bondage, and our suppliers now developed a migrant recruitment policy and are now assuming all responsibility for the recruitment fees. So this is also like a major step forward. And the final one, I think the IT industry is not known for its transparency, but during this 2-year work we've done, we also, in dialogue with Dell, have come to a full transparency as it comes to supply chains and audit reports, etc. So I think that public procurement or sustainable procurement can make a difference. However, we're not satisfied, obviously. There's still a long way to go. So I would just like to say a few words of the challenges we are facing and what I think needs to be done in the future. Harmonization is one thing. We really need to set clear goals for where we want to be. We have a vision, but we have to set goals where we want to be in short term, like for 1 year, 5 years' time. We also need to develop the sustainability criteria, and that process will actually start in October by the National Agency for Public Procurement. I know that work is already being done now to put together these expert groups, and this also obviously needs to be done in collaboration with the UNDP and the processes that are being developed in other parts of the world. Making relevant demands are important, but we have to also harmonize them. To make it also easier for the industry to enter into contracts with governmental contracts. Internally, coordination, I say this is really important for us to do that. Working with these kind of issues, it's you have to build internal competence for doing this. You have to put enough resources to do follow-ups, etc. This is like internal issues that we have to work with. And also, when we find violations, what do we do? What kind of escalation measures do we have? And the third one, I know that a few other speakers have mentioned transparency, and sometimes it can get tricky to get insight into our supply chains or into our suppliers' methods for ensuring compliance. One part is the parallel import of pharmaceuticals. That is an important issue, but also with our other suppliers. And I think we, together with the industry, need to develop methods and tools for increasing transparency. I think that's a really important issue to go forward with. On that note, I hope to see many of you tomorrow, where we're going to continue the discussions. I know that the cluster group is really grateful to Karin Lonnius, who has done a report on these issues, which will also be published soon. Yeah, I am there. Thank you.
Thank you very much, Pauline. I will start with one question, but I ask you to think about the second and third question. And Pauline, what is the main challenge now, and how to overcome it?
I think there's a lot of initiatives. I think there's a lot of good work being done. I lack the political leadership in this. I would like to see, we have to harmonize the demands, absolutely. And I think the key I think what this collaboration has shown, that we need to do this in dialogue with many different parts, because, you know, there are a lot of people in the supply chains or in the cycle that needs to cooperate to solve it.
Is the lack of political leadership, is that on the county level or on national level?
Well, I mean, I can only speak for the county councils level. I mean, yes, there's strong support. They have adopted a code of conduct for suppliers, but that's not really enough. I would like to see much more.
Thank you. Any questions? Yes, please. The microphone. Please. And yeah, we are recording it, so please. Yeah.
I was just wondering how does this work with the EU legislation? Because I was thinking it has to do with trade, etc., and they're usually not so fond of trained hindrances.
Well, we are obliged to work under the procurement directive and the national legislation for that. But and we are doing this within this framework. So yes, we can and we should.
Any more questions from the audience? Then I have another question. What would be the next? It was really good news with the report from Swedish and about the progress which has been made. What would be the next important step, you think, now?
I would like to see one of these reports also for the pharmaceutical industry.
Yeah. Okay. Okay, thank you very much, Pauline.
Thank you.